cure yet for COVID-19. DOH programs of immunization and TB medicine remain available despite pandemic. The Department of Health reiterated that as of today, there are no FDA-approved medicines or vaccines with indication for use against COVID-19. FDA Director General Orlando Enrique Domingo clarified during the DOH Beat COVID-19 virtual presser that there are no drugs or vaccines with an approved indication for the treatment of COVID-19, nor are there any pending applications for it. Kapag sinasabi po kasi natin na ang gamot ay rehistrado or aprobado ng FDA, ibig sabihin, yung gamot po na yun ay nasuri na mabuti at na-testing para sa partikular na sakit na sinasabi niyang gagamitin niya, explained Domingo. DOH explains COVID testing protocol. The Department of Health today clarified that assessment by a licensed health professional remains a prerequisite before one could get tested for COVID-19. Those who think they are infected will still need to be assessed by a health professional. They can do this in the comforts of your home through telemedicine consultations. Health OIC Undersecretary Maria Rosario Vergiri explained during the DOH's Daily Beat COVID-19 virtual presser. OIC USEC Vergiri also stressed that those most at risk for COVID-19 will be prioritized for the expanded testing as prescribed by DOH Department Memorandum 2020-0151 and reiterated by Department Circular Number 2020-0179. She was referring to these two priority subgroups of patients or healthcare workers with severe or critical symptoms and history of travel or exposure, and patients or healthcare workers with mild symptoms, relevant history of travel or exposure, and considered vulnerable, 60 years old or older, has other illnesses such as hypertension and diabetes, or is immunocompromised. Patients or healthcare workers who are not considered vulnerable but with mild symptoms and relevant history of travel or exposure, and those with no symptoms but have relevant history of travel or exposure will also be tested under the expanded testing scheme. DOH. Every Filipino is covered by PhilHealth's COVID-19 case rates. The Department of Health today announced that PhilHealth has issued guidelines on case-based payment of benefits. PhilHealth Circular 2020-0009 benefit packages for inpatient care of probable and confirmed COVID-19 developing severe illness outcomes for COVID-19 patients. This is part of PhilHealth's mandate to ensure that all Filipinos have equitable access to quality, affordable, and accessible health care services. Health OIC Undersecretary Maria Rosario Vergere said during the Beat COVID-19 virtual presser that featured Dr. Shirley Domingo, PhilHealth Vice President for the Corporate Affairs Group, as its guest. According to Dr. Domingo, patients confined as probable or confirmed cases can avail of the benefit packages as follows: 43,997 package for patients with mild pneumonia confined in Level 1 to Level 3 hospitals, 143,267 pesos package for those with moderate pneumonia in Level 1 to 3 hospitals, 333,519 pesos package for patients with severe pneumonia confined in Level 2 to Level 3 hospitals, including ICUs, and 786,384 pesos package for patients with critical pneumonia confined in Level 2 to Level 3 hospitals, including ICUs. These packages cover the rates for a private hospital room, management and monitoring of illness, laboratory, diagnostics and imaging, medicines included in the guidelines and protocol of the DOH, and supplies and equipment, including PPEs. Tuloy-tuloy ang bayad ng PhilHealth sa lahat ng COVID-19 cases, declared Dr. Domingo. PhilHealth will cover all expenses for patients admitted from February 1 to April 14, 2020, while the newly issued case rates will apply beginning April 15, 2020. Rates will be adjusted upon review of new evidence and updates on guidelines, protocols, and costing are introduced. Additionally, all health workers, including those essential to the frontline service exposed to COVID-19, will be fully secured by PhilHealth in the entire duration of the pandemic. As of this afternoon, the Department of Health posted 6,599 confirmed COVID-19 cases. 654 individuals have recovered and 437 died from the disease. Good afternoon, viewers. I am now here with Nurse Vice. Nurse Vice, I have common questions about COVID-19. These are found on the internet. Could you answer this for us, please?
Yeah, okay.
So first question, what is the recovery time for the coronavirus disease?
For mild cases, it is approximately 2 weeks. Meanwhile, for severe or critical disease, it is 3 to 6 weeks.
Okay, second question, what happens when you get the coronavirus disease?
People with COVID-19 generally develop signs and symptoms, including mild respiratory symptoms and fever. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Most people infected with COVID-19 virus have mild disease and recover.
Okay, next question, how long does the coronavirus last on surfaces?
It's not certain how long COVID-19 survives on surface, but it seems to behave like other coronaviruses. Studies suggest that coronavirus, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours or up to several days.
Okay, next question, what if I feel sick? Do I have the disease now?
If you feel sick, you should rest, drink plenty of fluid, and eat nutritious food. Stay in a separate room from other family members, and use a dedicated bathroom if possible. Clean and disinfect frequently touched surfaces.
Okay, nurse, thank you for answering the questions. CK Vargas,
You're
reporting,
welcome.
Weasel News. Stay home, save lives. Help stop coronavirus. Follow these 5 steps. Stay home as much as you can. Keep a safe distance. Wash hands often. Cover your cough. Sick? Call ahead. CK Vargas reporting, Weasel News.